So the great news is if you are advised that you need to have a hip replacement, you needn't worry. It's a fantastic operation and the recovery is quicker than it's ever been. So you're normally in hospital for between about 1 to 3 days, and after the surgery you can walk immediately, normally with the aid of crutches or a frame to help you get about. But you can move unrestricted now without the need for traditional hip precautions. Hip replacement's a fantastic operation. It's the second best ever operation invented, second after cataract surgery for eyes. So the results are great. And we're now really good at getting into the hip joint with less invasive techniques where we don't have to cut as many muscles. We can kind of sneak in between muscles. And we can do the surgery quite well now through smaller incisions. I've got a model of a hip replacement here, which I'll show you. See, this is the patient's femur or thigh bone with a component inside, and it's like a ball. And here's a patient's pelvis with a socket or a cup inside, and the two components click in like that, and then you've got a new hip joint. So in summary, don't worry if you need to have a hip replacement. The recovery is incredibly quick, especially if you have a surgeon who does it lots and lots.